So maybe as we are still entering the session, I would take this moment to welcome our speakers for the evening. So as I mentioned earlier, this is Project Protect's Resiliency Dialogue Workshop number 15. And the session is everything you wanted to know about the COVID vaccine or are concerned about. And we are very privileged to have a distinguished panel of speakers, including Christian Wong-Tam, who's Toronto's City Councillor and the Vice Chair of Toronto Board of Health, and the Chair of the Toronto Accessibility Advisory Committee. We are very happy to have Domenico Cala, who is the Manager of COVID-19 Community Engagement and Outreach Team at the Toronto Public Health, and as part of the city's pandemic response, been providing leadership on outreach activities on different communities and neighborhoods. And we have Dr. Stephanie Goh, who internal medicine specialist who's been at the front line of COVID-19 since the first wave. And also Dr. Daryl Tan, clinician scientist and infectious disease specialist at St. Michael's Hospital, who are at the forefront of HIV, STI, and viral disease research. So we are very grateful that all of them find time to share with us tonight their knowledge, their information about the different work they're doing in the communities and the communities they serve. So we're looking forward to a very exciting evening. And my name is Alan Lee. I'm actually one of ProTech research team members, and I work as a primary care physician at Regent Park Community Health Center. And I am part of the community engagement team at ProTech. And I would also like to acknowledge my colleagues, Keith Wong, who's the manager of ProTech, and Rain Chan, who is the community engagement coordinator. So thank you for completing the poll, and we would like to do our NAN acknowledgement before we start the formal proceeding of the evening. Rain?
Hi everyone, Rain here, Community Engagement Coordinator here. So before we begin, let us take a moment with gratitude and respect. Our team here at ProTech honors and acknowledges that we are gathering on a sacred land covered by Treaty 13, signed with the Mississaugas of the Credit, and as well as the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. Toronto is located on the Dish with One Spoon territory, which is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bounds each other to share the territory and protect the land. Subsequent Indigenous nations and newcomers were invited into this treaty in the spirit of peace, friendship, and respect to share and care for the resources of this land. We are aware of the ongoing impact of colonialism, racism, and other forms of discrimination and social injustices that disproportionately impacts Indigenous people, as well as racialized communities here on Turtle Island, also known as North America. We stand in solidarity to continue our fight against anti-Indigenous, anti-Black, anti-Asian, Islamophobia, and any other forms of racism and social oppressions locally and globally. So as well, just to remind everyone here that we want to make sure that we're respectful of everyone. There's a lot of us here today, so we want to make sure everyone understands we're not going to tolerate any harassments of any kind online. If you want to ask questions, there is the Q&A box at the bottom of your screen there, which you can click and ask the questions. Or you can also click in the chat box and click all panelists and attendees, or all panelists to decide who you, if you want to share your questions there as well. We will have a section at the end specifically for questions and answers, so you're welcome to save them for later or ask them as we go along, but just so that you know, we will be answering questions after everyone gets a chance to speak.
Great, thank you, Rain. So we apologize. We started a couple minutes late, so we wanted to maximize the chance for our speakers and for you to ask questions. So because some of the questions might pertain to areas of work of multiple speakers, we would like to collect them all and then organize them and then have the panelists address them after they've all have a chance to speak. So if you, as Ring said, you can start to send in your questions and we'll organize them and we'll try to address them the best we could. So without further delay, we would like to invite and welcome our first speaker, Dr. Darryl Tan.
Great, thank you so much, Alan. Thanks to the whole ProTech team for putting this event together and for inviting me to speak. I've been asked to speak today a little bit about the COVID-19 vaccines in Canada and specifically their efficacy, in other words, how well they work, as well as their safety. So I'll try to do that fairly quickly in the next kind of 12 to 15 minutes or so. And you'll see that I've started off with a picture of the virus itself, which is shown here. And I put it here because I wanted to show you all that from what we understand of this coronavirus, it's covered in these little yellow proteins that are sticking out of it that are very important. They're called the spike protein. And this is really important because it is actually the thing that the virus uses in order to bind to the cells of the human body and then cause an infection. And as a result, all of the vaccines that we're going to talk about today are actually designed to train our immune systems to recognize that spike protein on the surface of the virus in order to block infection, prevent the virus from getting into our cells and our body. So as you may know, there's currently 4 different vaccines that have been approved for use in Canada. They're made by different companies, each shown here. So you may remember that back in the fall, there was a Pfizer vaccine together with BioNTech, and then a Moderna vaccine. More recently, just within the last week or so in Ontario, the AstraZeneca vaccine has become available. And I've listed here along with that, the Serum Institute of India. That's another organization that's based out of India that has been licensed to actually produce that same vaccine. So it's 2 different manufacturers with the same product. And the 4th one that just got approved very recently, within the last 2 weeks here in Canada, is manufactured by Janssen, which is part of Johnson & Johnson. I'm going to show you a table here next that shows you some of the key characteristics of these different vaccines in a busy looking table. The first thing to say is that these first 2 vaccines, Pfizer and Moderna, are what you may have heard of as mRNA vaccines, whereas the AstraZeneca and Janssen vaccines have in common that they're what we call viral vector vaccines. Now, I'm not going to talk a lot in detail today about what the difference is between those different mechanisms. They're just different technologies that have been developed for vaccines. All I do want to say about them, though, is that these are technologies or methods for making vaccines that have actually been invested in and studied and developed over many, many years now. Actually, a lot of it comes from work that has been done in trying to develop HIV vaccines over the years. And it's actually as a result of all that work that's been going on in the background for so many years that has allowed companies and researchers around the world to develop these vaccines as quickly as they have. I know a lot of people have a lot of concern or a lot of questions around how could it be possible that the world could have come up with so many vaccines that are so successful so quickly. And sometimes that leads people to be a little apprehensive or worried about the vaccines. And in fact, the answer is that they're not just a year old. These vaccines are actually many, many years in the making. And all that had to happen was once the structure of the SARS-CoV-2 virus that causes COVID-19 was figured out, which happened very quickly after the pandemic began, all that had to be done was bits of that spike protein had to be inserted into these different frameworks in order to develop these vaccines. And that's why we've been so successful at getting vaccines so quickly against COVID-19. Now you can see here also that the vaccines differ in terms of how many doses people need to receive. Most of them require 2 doses, and so far the Janssen vaccine only requires 1, although it's still being studied for potentially being given as 2 doses. And we'll talk a little bit about the timing of those doses in just a minute, because I know that's also another important question people may have. You can also see here that So far, they're all only approved for use in adults, defined as people greater than or equal to 16 or 18 years old. And the trials are going on right now for their use in children, but we don't have that information yet. It's expected that they're going to work extremely well in children as well. So with respect to that last issue, working extremely well, that's what this last row here summarizes. So efficacy here is showing you the percentage reduction in cases of confirmed COVID-19 that we're seeing in the big clinical trials of these different vaccines in the vaccine arm, and comparing that to the group that didn't get the active vaccine. And what you may remember from the fall is that we were all very excited to see tremendous efficacy for the 2 mRNA vaccines, almost the same number, in fact, like 94, 95%. You might have also heard, though, that the newer vaccines, in particular the AstraZeneca vaccine that's now being rolled out in Ontario, has a somewhat lower number here. Now, before we get too excited about that difference, I want to make a couple of very important points about how we should be thinking about this number. The first thing to say is that it's always hard to compare directly the results of different studies that were done in different contexts at different times in different parts of the world. And that's definitely true with respect to what's been going on with the COVID vaccines. Both of the AstraZeneca and the Janssen vaccine trials were done in parts of the world at a time when these new variants of concern that many of us have been hearing about in the news were widely circulating. It's thought that at least one of the reasons that we might have seen some lower efficacy in these particular vaccine trials compared to the mRNA vaccine trials has to do with the fact that the virus is actually mutating every day. And those variants essentially represent small changes or mutations in that spike protein that I showed you a few moments ago. And that allows these viruses to evade or hide from the immune response that we've been trying to target in all of our vaccine efforts. In fact, consistent with that idea, there's actually new data that's just coming out in the last 1 or 2 weeks in some of the major medical journals that are showing that, unfortunately, even these excellent vaccines with the mRNA platform seem to have a slightly lower efficacy when we're looking at their efficacy against the new viral variants. So that's one important thing to keep in mind. A second important thing to keep in mind is that regardless of the absolute number here, across the board, all of these vaccines show tremendous efficacy, and they definitely surpassed the thresholds that Health Canada had set well in advance for what it wanted to see in a vaccine in order to be licensed. Those targets were established way before any of the vaccines had their study results. And all of these vaccines clearly do better than that target. They're all extremely effective, and we should be really actively embracing their use. The last thing to say about those numbers is that those numbers represent the efficacy from the initial clinical trials with respect to preventing known cases of COVID-19. But what's perhaps even more important is how well these vaccines protect against severe disease. By that, we mean COVID-19 that's bad enough to land somebody in hospital or even kill them. And what you can see in this row is that the numbers are much more impressive across the board. This is the thing that we're most worried about, of course, with COVID-19 and all of the vaccines, although the numbers I put in parentheses because they're a little bit less certain, there's a little bit less data on this because it's a rarer event, all of them seem to do very, very well at preventing that most important outcome. And so that's something that should really reassure all of us about their efficacy. Now, another question that people often ask us is whether these vaccines work differently in different groups of people. And this is a slightly complicated graphic that I'm showing to try to illustrate that overall, there's not tremendous difference in the percentage reduction in COVID-19, in other words, the efficacy or effectiveness of the vaccine shown here at the bottom, with all of the different vaccines shown in the different colors according to the subgroup of person. If you look at this very carefully, you might notice that some of the dots here that represent how well the vaccines work in slightly older populations, so older than 64, for example, compared to younger groups, it does look like the vaccines don't tend to work quite as well. That's the same that we observe for virtually all of our vaccines, so it's not a surprise. But across the board, again, the important thing to say is that all of them very clearly surpass that Health Canada minimum threshold for authorizing a vaccine for use. So again, this should really reassure us that these all are vaccines that are effective pretty much no matter who you are. Sometimes people may have questions around ethnicity as well. There's no reason for us to believe that any of these vaccines are going to work differently according to the ethnicity or the racial background of the person. The key thing that we do think is important might be age, but that's the same with all vaccines. Now, this issue about the timing of the second dose is a really important one that's been in the news recently, and I do want to touch on it because what you may have heard is that, as we know, many of the vaccines require 2 doses, but the timing of that second dose that was originally studied and initially approved is a lot shorter than now what is being done. Typically in the trials for the Moderna and the Pfizer vaccine, for example, it was to the tune of around 3 to 4 weeks or so to get the second dose. For the AstraZeneca vaccine, it was actually anywhere from 4 to over 12 weeks between the doses in the initial trials. But the National Advisory Committee on Immunization, or NACI, which is an organization of scientific experts from across Canada that makes recommendations about the use of vaccines in Canada, has come out with a statement just a number of weeks ago recommending that we systematically or always delay the timing of that second dose for people till 16 weeks or up to 4 months later. So that might sound alarming to many people, but I think it's really important to understand why that was a recommendation that was made and why I think most authorities around the world who are thinking about vaccines and know a lot about the science here think is actually a very smart idea. One of the key reasons is that we already know that after the first dose of any of these 2-dose vaccines, we already start to see significant reduction in risk. And that risk is evident as soon as about 2 weeks pass from the first dose of any of the vaccines. Another reason is that, in fact, some of the vaccine trials actually seemed to show that the later your second dose was, the better you did. We know that the best for the AstraZeneca vaccine. People who got their second dose 12 weeks or later did better in terms of how well the vaccine worked compared to people who got their second dose between 4 and 12 weeks. And then the final reason, and perhaps the most important one, is that all of this is being recommended for the simple reason that we simply don't have enough vaccine to go around right now. And that's the case around the world, not just here in Canada. And in that sort of situation where we're fighting a pandemic that keeps on mutating, that keeps on infecting and killing people every single day, it is so critically important for us to do everything we can to protect as many people as possible. Even if that amount of protection isn't 100% right away, the fact that we can reduce infection risk for many, many people, in fact, double the number of people, is a very strong reason to make this recommendation. And it's being done not just here in Canada, but in many other settings around the world as well. The second topic I'm just going to touch on briefly is side effects and safety before I wrap up. This is, again, a slightly complicated image, but it's intended to show the frequency, which is shown here on the bottom, the x-axis or the horizontal lines here at the bottom, the frequency of different side effects that people might get after their first dose or the second dose of the various vaccines, shown in the different colors here. And not surprisingly, if you get a jab in the shoulder for a vaccine, the most common thing you get is a little bit of pain at the site. Not a surprise. You might also get a little bit of redness or swelling. Sometimes people also not only have local reactions, but also systemic reactions. And specifically, we're talking about feeling a little under the weather, maybe a bit of even fever or fatigue or headache. A lot of these things are, importantly, a little bit more common after the second dose than the first dose. And that's what these numbers represent there, the frequency of these different side effects that people might get. As people who think a lot about infectious diseases and vaccines, it's worth pointing out that none of these side effects are a surprise. All of these are things that we would expect to see if we trigger somebody's immune system, and that's exactly what these vaccines are designed to do. So you can almost think of it in a way as a good thing if people get a little bit of these mild side effects after getting the vaccine. The vast majority of these side effects are mild or moderate at worst in severity, and they typically go away in a matter of just days. So it is recommended that people could use Tylenol, acetaminophen, or ibuprofen, in other words, Advil or Motrin, anything over the counter like that, just to help settle down the symptoms if they're bothersome. It's true some people need to take a day off or two, but certainly these are mild side effects overall that go away and are not unexpected at all. Now, there's been a little bit more fuss in the news recently about something going on with that AstraZeneca vaccine in Europe recently. So I want to touch very briefly on this topic as well. This is an issue that's still being actively investigated. It's still in evolution. But what has happened is that a number of countries in Europe have put pause on their vaccination campaigns in order to investigate a very limited number of blood clots that have happened in some people after they got the vaccine. And what you can see from these flags is that in the European Union, after giving about 5 million people their doses, and in the UK, about 11 million, so total here, about 16, 17 million people have been exposed to this vaccine. So far, the number of cases is really quite small, 30 cases in the European setting. No difference is the summary statement from the UK about the number of times they've seen this compared to what you would have expected to see in the population. And in Canada, it's just too early to say. There's only been 500,000 doses that have been distributed, not even yet fully administered. So the whole situation is under investigation. Many of the European countries have come out and explicitly said they suspect that they'll be later on accused of being overly cautious. And that's all that's happening right now. So far, to me, it doesn't particularly look like this is anything other than what we might have expected just in a population, regardless of whether they got a vaccine or not, when you're talking about this many people. The main side effect that we heard about at the very beginning of the vaccine campaign, and really the only reason that we would medically recommend to someone not to get the vaccine, is if they know that they're going to have an anaphylactic reaction, in other words, a very severe, life-threatening allergic reaction to one of the vaccine components. So anaphylaxis, if you haven't heard the term before, refers to such a bad allergy that you get swelling of the lips and tongue and throat that can lead to some difficulty breathing. It's the type of thing that you might have heard of, affecting young kids who are maybe at risk of anaphylaxis with peanuts or a bee sting or perhaps a medication. This is really the only reason not to get the vaccine. Some people may be puzzled about how they're supposed to know whether or not they're going to have an anaphylactic reaction to one of the vaccine components. And the answer to that is that, this is such a rare reaction that if someone is anaphylactic to something out there in the world, it's typically something that they would already know, okay? Sometimes it can happen out of the blue, but most of the cases of anaphylaxis that happened in the trials and have happened in the rollout so far have happened in people who already have had anaphylactic reactions to other types of things like medications or foods in the past. Because of this possibility, that's why it's recommended that after you get the vaccine, you're going to be asked to stay in the waiting area just for an extra 15 minutes to make sure you do okay. If you have a history of prior anaphylaxis to something else, you'll be asked to stay for a little bit longer, maybe half an hour rather than 15 minutes, because virtually all of the cases where this happens present, in other words, they become obvious within the first 30 minutes after actually getting the vaccine. So, like I said, that's really the only medical reason that we know of so far where we would actively recommend for someone not to get the vaccine. Vaccination truly is recommended for virtually everybody else. So that's true whether you've had COVID vaccine already. In fact, we think that the vaccine response is better than the response to COVID-19 itself. It's true whether you have an immunosuppressive condition, a medical condition, or some other chronic medical condition. We still think that there's benefit here, and the vaccines are thought to be safe. Even in pregnancy and breastfeeding, although that wasn't explicitly studied in the original trials, again, the risk of COVID is perhaps a little worse, we think, in pregnancy, and so there's going to be benefits to getting the vaccine overall. If you do have questions, something to talk to your healthcare provider about. So that's where I'll end my comments. I'm happy to take some questions later on, and I'll pass it over to the next speaker now. Thanks so much.
Thank you, Daryl, for a very informative talk. And then we'll get Stephanie to add to some of the more special issues within the context of vaccine. Thanks, Stephanie.
Sure. Share my screen. Sorry, some technical difficulties.
Oh, so maybe when you're sorting that out, can I just ask Daryl a couple of clarifying questions? So when we talk about extending the time period of the doses, the second dose, is that, would people worry about like the effect dwindling off before people get the booster or not?
It's a great question, Alan. And I think the short answer is we shouldn't be too worried about that. The best answer is we don't have data on exactly that question for exactly this vaccine. But what we do know is that protection does rise within just 2 weeks of getting that first dose. And all the clinical trials so far look like your protection gets better and better over time after you've gotten that first dose. We also know from our experience with many other vaccines that the concept of boosting the immune system is just a property of how our immune systems are designed to work. Once you are exposed to something once, for example, with the first dose of a vaccine, then the goal is simply to remind your immune system of what that thing was so you can get an even stronger response. And the exact timing of that, there's not any particular reason to think that the magic number is necessarily 3 weeks or 4 weeks. That is what was studied and chosen in those initial trials to be efficient, but there's nothing magical about that number beyond that. It makes a lot of sense biologically that you'll still have an excellent response if you get that second dose a little later on.
Okay, thank you. Stephanie, are you ready?
You're muted.
Stephanie, you're muted. I could ask more questions. Okay, so I guess the other question is, I think you talk about that, well, there is a question, are people with genetic diseases needs to be concerned about like Down syndrome or other things, like okay to take the vaccine?
Yeah, thanks, Alan. Thanks for whoever asked that question. The short answer is yes, it should be okay. There's no particular reason to think that the vaccine wouldn't be safe, which is the most important thing, regardless of a whole host of underlying medical conditions. These are not live vaccines, which is a really important concept to understand. Some vaccines that we give for certain things are what we call live vaccine, and the vaccine itself can replicate inside the person who gets that. That's not the case for these vaccines, either the mRNA ones or the ones that are confusingly called viral vector vaccines. So they're safe to receive. It's possible that how well it will work will vary from person to person based on some characteristics like age that we talked about, maybe some medical conditions, but there's no reason to not get it just because of having a specific condition such as Down syndrome.
Yeah, in fact, I would think that like people with more chronic disease would be better off if they get more protection earlier, right?
Absolutely, yes. That's part of the reason that people with underlying medical conditions are going to be prioritized relative to otherwise healthy people in the rollout.
Mm-hmm. Yeah, so thank you. Stephanie, we can do the slide for you.
No, I think I got it.
Okay.
Try again.
Thank you.
Okay, so I've been asked to talk about some of the special considerations in terms of population issues and health issues in regards to COVID-19 and the vaccine. So I think Dr. Tan already addressed this a bit, but one of the questions I think that has come up a lot is whether or not you need to get tested before getting the COVID-19 vaccine. So the answer is no, you don't need to have a COVID-19 test before you get the COVID vaccine, and I'll get into that in a different slide. But essentially the recommendations from public health remain the same, that you only need to get tested for COVID-19 if you have any symptoms suggestive of it, so fever, sore throat, cough, etc., or if you've been exposed to someone with COVID-19 in an unprotected setting. So bottom line, you don't need to get a test. The other question that people have asked is what if you've had COVID-19 before, do you still need to get the vaccine? The answer is yes, you should definitely get the vaccine. You shouldn't get the vaccine while you're having COVID-19. I've actually had inpatients ask me this question yesterday. Somebody came in with COVID and asked, can I get the COVID vaccine now? The answer is no, you shouldn't get the COVID vaccine while you're sick. It's not that after you've had COVID-19, you actually develop some immunity to the infection. So it offers some degree of protection. We're not exactly sure how long that lasts. I think there was a recent study actually just published today that suggests that there's some level of immunity for about 6 months, but again, we're not exactly sure how long. So because we don't know how long and we know that the vaccine provides longer protection for you, we are still recommending that you do get the vaccine, and so that it protects both you and also others around you from yourself getting sick and from you spreading it to others around you as well. The other question that I've been asked is, okay, so I'm vaccinated now. Can I go out? Can I see my friends? Can I go to restaurants? Can I unmask? Unfortunately, the answer right now is still that you have to follow public health guidance. So that includes physical distancing, wearing a mask, staying at home if you're sick, if don't go outside your bubble. And the reason why we say that is because while we know that the vaccines are very good in preventing severe disease, we still actually, for one, you can still get sick, you can still develop COVID. Not all of them are 100%. And the other issue that's still being researched right now is whether or not the protection actually involves whether or not you can transmit it to others. So you may be asymptomatic yourself, but we still don't know whether or not you are able to transmit to other people. So as of right now, even though you're vaccinated, we're still recommending that you need to follow public health guidelines. So like I said, just to expand on that, the other reason is that also it takes about, Dr. Tanner said that it takes about 2 weeks for your body to develop some degree of protection, and not the protection is not completely 100%. So again, you need to follow public health guidelines. This topic has also been talked about a lot, like what is herd immunity, and in the news they talk a lot about, oh, we need to reach herd immunity and that point we'll be protected. So what exactly is herd immunity? So herd immunity is a concept where a significant proportion of the population becomes immune to an infection. So whether that be through vaccination or to prior exposure to the disease. And the thought is that the more people become immune, or the significant population becomes immune to an infection, there's less people that are susceptible to getting the infection. So when there's less people that are able to be infected, thereby there's less people to pass it on to those who are not either currently infected or have not been, or who cannot get the vaccine. So different infections have different levels of herd immunity. With COVID-19, we still don't actually know how many people need to get vaccinated or to have had prior infections prior to us achieving herd immunity. Public Health Ontario right now estimates about 56 to about 89% of Ontarians need to be vaccinated before we achieve herd immunity. So the bottom line is, the faster we all get vaccinated, the better protected we all are. And I think that's plays a role into why we are extending our vaccine timelines so that we can get more people protected. Another question is, other than age, who should be, or why, how do we consider who is priority for vaccination? So NACI, which is the National Advisory Committee on Immunization in Canada, it's the scientific group that comes up with these vaccine recommendations, put out this table. It's a busy table about who they are recommending in terms of the different phases of rollout of the vaccines. So number one would be age, because we know that the older you are, the higher risk you are of developing severe COVID and death. The remainder are, so frontline healthcare workers are those who work directly with COVID-19 patients in hospital or nursing homes. Indigenous communities, because they all also have been shown to have increased risk of severe COVID. Residents and staff of congregate living settings, so group homes, correctional facilities, adults in racialized, marginalized communities, such as members of the Black Canadian communities, frontline workers who can't work virtually, so like grocery store workers, essential caregivers, so those people who look after these high-risk groups, and then first responders, so these include paramedics, police, etc. How did they come up with these recommendations? So essentially, they based it on the risk of how severe somebody may get sick if they develop COVID-19. So like again said, age is a significant risk factor for developing severe COVID and subsequently, unfortunately, dying. And then also how high risk you are in terms of exposure. So that would explain why frontline healthcare workers are in the list, because again, they work day in, day out with COVID-19 patients. So once we're all vaccinated, what does that mean for our future? Unfortunately, life probably won't return back to normal, at least for a few more months. And the reason why is, as Dr. Tan said, we simply don't have enough vaccines right now, and it will probably take a few more months for us to achieve herd immunity. So in the meantime, it's definitely very, very important to follow public health guidelines, socially distance, and when it's your turn to get vaccinated, you should go ASAP, because the faster we all do this, the faster we will get out of it. So I'll turn it on to the next speaker, I think.
Thank you, Stephanie. And I know that some people are sending in questions. We will deal with them because we've also collected a number of questions before the session. People have been sending it in through email. Some of them are kind of related, so then we're gonna group them together. So we'd like to, at this time, welcome our next speaker, Domenico Cala from Toronto Public Health, who's gonna show us what the plan is and how you can get the vaccine. Thanks, Domenico. You have to unmute yourself first, though.
Thank you for the reminder. 1 year later with web sessions, and I'm still forgetting to unmute myself. Thanks so much for having me. I'm going to talk about the city's rollout plan this evening. One thing to keep in mind with the rollout plan is that there's multiple partners and multiple organizations that are involved in the vaccine rollout. While this is a great thing in terms of us different partners working together, I know that it has also created some confusion because there are many different options available to people who are eligible to get vaccinated. And I hope to clarify that as much as possible today. Before I go into anything else, this is getting a little bit of an overlap with Dr. Go's presentation in terms of the priority phases for vaccination. It's the province of Ontario that sets the
Sorry. Domenico, your slides has some section blacked out.
Oh, is that right?
I wonder if then it will be captured on the video. Would you like us to share screen instead? Because there's 2 black bars that cover some of the titles. Maybe we can share screen because we have your slides too.
Yeah.
Is that okay?
Hi there. Is this at all better?
No.
No.
Oh, okay, fine. Share my slides.
Okay. Sorry about that. Because we actually, it's good time to remind the audience that the video will be available on YouTube and it will be subtitled into Chinese as well. So for your friends who missed this session, please remind them to tune in.
All right.
Okay.
So the slides you have are in a different order, but that's okay. I can go on the fly. Next slide. So the city is running 9 or will be running 9 mass immunization clinics across Toronto. Not all of them are open just yet. We have 3 of them that are currently open. One in the West End, the Toronto Congress Centre, one in the downtown core, which is the Metro Convention Center, and then one in the east, and I'm talking about the Scarborough Town Center. In the next week, so next week, 2 additional clinics will open, one in Malvern and the other in the North York area, number 18, the Mitchell Field Community Center. And then on April 5th, the hangar near number 6 will be opening, and that's just in the Downsview Park area. And then in terms of the remaining clinics, this really depends on when Toronto Public Health gets direction from the province, and it will depend on the vaccine supply that is available to us, okay? In order to book an appointment with a clinic run by the city, and this is where it kind of gets a bit confusing. So there's a separate booking system. This is the provincial booking system that Toronto Public Health is using for people to book our clinics. So you can look, you can book online, and you can book with by calling the number on your screen. Now, let's say you don't have a health card, or let's say you have the old red and white health card. Anyone have one of those? You must call the provincial booking system. The online system won't let you book. You can get your vaccine without a health card, but you do need to call the number versus booking online. So next slide. Oh, and by the way, the city right now is booking people who are 80 years and over at this time. You must be turning 80 this year. So if you're 79, but you're going to turn 80 at some point this year, then you are eligible. Hospital clinics. So the hospitals and Ontario health teams, they're also running clinics. Some are located right inside hospitals. Others are located outside of hospitals, but they're all run by the hospital. There's a separate booking system for this. So you would have to go to vaccineto.ca to book at one of these hospital-run clinics. You can book by phone, and you can also book using the chat feature on the on their site. So they're vaccinating people 80 plus, healthcare workers, Indigenous adults, and they're also going to start vaccinating people getting chronic home care very soon. So the next slide, just hopefully I'm not confusing you, because now there's another layer. Pharmacies and doctors' offices are also offering the vaccine. They're offering, like Dr. Tan was talking about the AstraZeneca vaccine, they're offering that particular vaccine to people who are age 60 to 64. You need to make an appointment, and you need to call the individual pharmacy to make that appointment. Doctors' offices are also offering the AstraZeneca vaccine to 60 to 64 age range. What we're asking is that you do not call your doctor to ask them about the vaccine. The instruction we're giving people is to let the doctor call you, because once doctors receive their supply, they will call the patients between between 60 and 64 and to see if they're interested in getting the vaccine and booking them. Next slide. And then we have mobile clinics. these are clinics that can move around the city wherever they're needed to meet the needs of high-risk individuals and people who wouldn't readily have access to the vaccine clinics. So people who wouldn't be able to go to the clinics for multiple reasons, for example, accessibility reasons. And so right now, these mobile clinics are focused on people who are experiencing homelessness, so shelters, food programs, drop-in centers, as well as high-risk people living in Toronto community housing and seniors buildings. Next slide. So as more vaccine becomes available, we're anticipating that more vaccine clinics will come about. So hospital clinics may be extending vaccination to also being offered through community health centers, for example. But right now, if you look at, it will be our 9 city-run vaccination centers and the vaccination centers listed in vaccineto.ca. And as more locations get added, you will see those reflected in the vaccineto.ca website. I was asked to speak a bit about other aspects of the rollout. So we can have the vaccine clinics in place, but we want to make sure that people can know about vaccination and encourage people to get vaccinated so that people actually attend those clinics. So the city has developed a communications campaign with a sort of branding of "Let's get back, TO." So let's get back to normal. Let's get back to being able to meet with our family, friends. Let's get back to being able to go out to restaurants, etc. So as Dr. Go said, the sooner we all get vaccinated, the sooner we can hopefully say, farewell to the current pandemic and lockdown and restrictions. We are promoting vaccination through various means, bus shelter ads, for example, social media, and we're also offering a number of webinars to Toronto residents and workers to increase vaccine confidence in those groups. Next slide. And part of the city's rollout plan is also engaging those communities that have experienced historically barriers and discrimination to healthcare. For example, we're focused on the Black communities in Toronto. We have a Black scientists table on vaccination. We've run a number of town halls specifically geared towards the kinds of concerns that our Black residents in Toronto have. With Indigenous communities, we have dedicated funding so that the Indigenous community can determine how best to engage the community, educate on the vaccine. And then there's other priority communities like seniors and people with disabilities. And one example here is that the city is working on sort of a transportation plan for seniors, for people with disabilities, or anybody else who is not able to access the clinic because travel is a barrier. So, so those are some of the ways in which we are emphasizing equity and a targeted equity approach to reach those people that would have the greatest barriers and face the most discrimination in the system. Next slide, please. The other part of the community engagement is that the city is funding organizations, community organizations, so that they can, so that in total, they can recruit about 180 neighborhood ambassadors to promote the vaccine in their community. And the thinking behind this is you know, people who are most hesitant about getting the vaccine are more likely to trust people that they know versus institutions like Toronto Public Health, like the province of Ontario, or the government of Canada. So this would be funding for, you know, people in your community who understand your community, who have an understanding of, you know, cultural sensitivity, have different language skills, language background, to train them up so that they can provide vaccine education to their fellow residents, their neighbors, their friends in the community. And then the city's also partnering with a number of community agencies to go door to door in a safe manner to promote vaccine and to really address vaccine hesitancy. Next slide. So this was the slide that I was starting with, but that's okay. This is just reflecting what Dr. Go talked about in terms of a prioritization of vaccine eligibility. So right now we're in phase 1, and you know, listed here are the groups that are in phase 1. Now, I want to let you know that this is all determined by the province of Ontario. And I know that there are other groups that people are advocating to have listed into phase 1 or listed into phase 2. Those are decisions made by the province, and the municipalities or the health units basically implement those. So in phase 1, we have seniors in long-term care homes, for example, in congregate living settings, healthcare workers, adults age 16 plus, who are Indigenous, and of course, adults over 80 years of age. And what's missing here is also the AstraZeneca pilot initiative for adults age 60 to 64. And then in phase 2, it's going to be adults between 60 to 69. And we're going to be phasing it in 5-year increments, working backwards from the age of 80. We're going to be vaccinating people in high-risk congregate settings, like shelters, people in community living, individuals with chronic, high-risk chronic conditions and their caregivers. There's actually quite a lengthy list on the Government of Ontario website on which high-risk chronic conditions are covered in phase 2. I have received questions about, you know, what kind of proof do I need to show to say, hey, I have this particular condition, or will it be an honor system? And the answer to that right now, unfortunately, is we don't know. We are waiting for the province to give us guidance about what kind of proof and how this is going to be, how this is going to work for us to implement it. And also other groups in phase 2 would be essential workers, frontline workers who cannot work from home, and other at-risk populations. This may include groups that have been more highly represented in COVID numbers, like Black communities and people living in other geographic areas that have high COVID rates. And then finally, in phase 3, July and onwards, it's adults 58 years and younger. So we open more widely to the general population. Next slide. So I often get the question, can I choose which vaccine I get? Dr. Tan talked about some different efficacy rates in the vaccines, and some people are more interested in one vaccine versus another vaccine. At this time, individual vaccine preferences cannot and will not be accommodated. All the vaccines work well, and they all provide protection against severe illness. So we're asking people to get the vaccine that they are offered. And each vaccine clinic is maybe offering different vaccines. So at pharmacies, they're offering a different vaccine than from the city-run sites. And in the city-run sites, we are mainly right now offering the Pfizer vaccine. But as supply changes, you know, we may be changing which vaccines that we're offering. But of course, we will be offering the same vaccine for the second dose. For people who received a specific vaccine in the first dose, we're going to repeat the same vaccine for the second dose. We do want to get people vaccinated as quickly as possible, especially given the new variants that are circulating in the community. We really want to get on top of this third wave of COVID. And next slide. I was asked to talk about some issues with regards to vaccine rollout and education. And here I'm talking specifically about vaccine hesitancy. The majority of people in Canada are intending to get the vaccine. But there's this segment in the middle, about 28, give or take a few, depending on the study that you're looking at, that are on the fence. They're not quite sure. They may be taking a wait and see approach to see what happens as other people get vaccinated. That really is the group of people that we want to focus on quite specifically, quite uniquely, to meet their informational needs, to help them make an informed decision and hopefully get them on the side of getting vaccinated. And you know, vaccine hesitancy is not distributed equally amongst the population. The groups with the most hesitancy, at least in Ontario, are Black and Indigenous communities. And that's why in our targeted equity approach, we are focusing quite specifically on these two communities. So that's my presentation. I hope I gave some clarity, and I'm happy to answer any questions at the end.
Thank you, Domenico. So last but not the least, let's hear from Councillor Wong Tam. Christian will run your slides.
Thank you so much, Alan, and thank you to everyone for your presentation. The advantage or maybe disadvantage of going last is that all these brilliant speakers have covered a significant amount of territory. So my hope is that I will be able to add something new or perhaps enhance on what was already said. But I do recognize that there is going to be a little bit of overlap. So chances are I'll ask that my slides be moved through very quickly. If I can get the presentation view, perfect. Thank you so much. So this is Kristen Wong Tam, everybody. It's great to be here with you tonight. And I just wanted to recognize how important it is that that ProTech has been organizing these webinars to ensure that our communities have good access to information and also in a timely fashion. So I just want to give a big thank you and a big shout out to the team that has been producing these webinars and also pushing forward the advocacy for our community. Next slide, please. I'm going to blow through this slide very, very quickly because I think Domenico did an excellent job of summarizing where the city's mass immunization process is. And I will just say that I know there's a lot of websites for you to consider. I'm going to advocate that you come through the city's portal. And the reason being is because we are populating this website with a lot of unique content that's very localized. So you can absolutely register on the provincial list through the City of Toronto portal. It will just bring you there. But while you're on the City of Toronto website, you're going to get access to a lot of localized Toronto specific information that you won't get anywhere else. And the city has been able to crowdsource all sorts of information from a number of different places. So it's really one-stop shopping. So that's all you need to know. And that, of course, is toronto.ca, COVID/19. Next slide, please. So I'm going to talk a little bit about how we are working with the other levels of government to plan and coordinate the vaccine rollout. Domenico did a great job of outlining where this is all going, but I want to just take a step back because I don't want to dwell on it too long, but I think it's important for us to recognize that every order of government has some responsibility with the vaccination program. So obviously the federal government was responsible for approving the vaccine and they continue to do that good work. And the province is responsible for building a province-wide vaccination plan, which will then mean that all the local health units and the municipalities and towns will then be working with our health partners to roll it out in communities, because obviously the province cannot do it province-wide. They need municipal and local partners. Next slide, please. The City of Toronto is working to promote the importance of the vaccine and to address vaccine hesitancy that was already discussed earlier. We need to ensure that we immunize as many residents as possible in the City of Toronto. We have a population of 2.9 million people. As of today, we've had 318,798 million people who have received one form of vaccine dose, which means we've got over 2.6 million to go. That is not a sprint. We have to consider this as a marathon, and we have to be able to move quickly, but we also have to pace ourselves. The City of Toronto is also working with agencies to make sure that we can immunize, that they can immunize, I should say, their own clients, and then to coordinate with our local health partners to do that. And all of this means that the three orders of government have got to work hand in hand. There is really no flexibility for deviation. And if there's one thing that we can all agree upon, the three orders of government, is that vaccination is a priority, and getting those shots into people's arms is mission critical number one. Yes, there will probably be a little bit of bickering over the type of supports that roll out in the different sectors, but when it comes to vaccines, I think that there is absolute consensus from the three governments that this has to be done. Next slide, please. So next slide, I want to talk about how to ensure that the vaccines get into everyone's arms. And really right now we are prioritized, and I think most people would recognize and agree that it is the vulnerable older population that has been hit the hardest when it comes to pandemic infections, and those who have a harder time recovering once infected. So this means that we have to take not a one-size-fits-all approach, although we have to ensure that we are able to directly apply vaccine prioritization for those who are most vulnerable. This also requires that governments need to work through and build better systemic supports to ensure the accessibility of vaccines, to ensure that we can get to the different marginalized populations. And one of those groups I would advocate would be Chinese seniors with limited English ability, English language ability. People living with disabilities would be another one. And in order to support the accessibility of vaccines, the City of Toronto is funding community organizations to build immunization mobilization plans. So that means that we know that the City of Toronto cannot reach every single unique population in the city. It is just impossible. And this is why mention the ambassador program. We also want to make sure that we focus on populations that have not necessarily always been identified, and that includes people who are LGBTQ2S. People who are living vicariously through different housing options, including those who are street involved and homeless. There are also people who are undocumented. So these are folks not necessarily with any immigration status, but we know that they live in Toronto, they work in Toronto, and Toronto is their home. We want to be able to reach them. And of course, young people is another very specific group that will need to have a specific targeted vaccination plan because they are going to be number one at the very end of the phase 3 vaccination, but also they're going to be one of the fastest groups that are also spreading the virus as we know it. Next slide, please. So this was already discussed upon earlier, so I'm just going to move through this very quickly because I think I'm going to try to raise points I don't think were covered. But really what the peer ambassador program is to make sure that people who are recognized leaders in their community, people that you trust, people that perhaps are in places of worship, and they have people that they communicate to every Saturday or Sunday, and you trust your faith leaders, we need to basically deputize these peer ambassadors to help us spread the message. So we are looking for active individuals and resident ambassadors right now. And if you can be a trusted ambassador, just so you recognize that we would be looking for people who have extensive networks in their communities. If you have perhaps if you're a micro influencer in the community, if you speak languages other than English, if it's necessary to communicate with that community, we're looking for you. People with really strong interpersonal communication skills who are willing to help us convey a message, a very on-point key message regarding COVID-19 vaccinations, how to address common vaccine hesitancies, and also to address risk reduction strategies when it comes to trying to prevent further spread of transmission. And of course, someone who really in the 21st century is able to jump on social media and help us amplify the messages. So if you are one of those individuals, or if you know some of those individuals who could be a great peer ambassador, I would say the city is looking for you. And so those are some of the things that we need to consider. And we're also looking to ensure that people who have vulnerabilities are going to, we're going to work towards removing the barriers facing those different populations. So such as elderly people, people living in long-term care facilities, as well as people who are on the front line, who are eligible for vaccines, but maybe still sitting on the fence. And that is not uncommon. I've heard of medical trained professionals who want to wait. So we want to be able to get out in front of everybody who is uncertain, whether or not the vaccine is for them. We need to be able to have almost one-on-one dialogue or larger community group settings so that people can have those opportunities and ask questions and have their questions answered. So if you can move to the next slide. Because as we move out of phase 1, we're going to be moving into phase 2. And phase 2 will include a different type of priority group. This will include people who live in high congregate settings, but who didn't make it into phase 1. And I can go there too, but it will also include people who are perhaps temporary foreign workers who are working in farms, people living with mental illness or addictions. And we already know about the variant spread that's taking place in some of our the jail settings. All of that I think is fairly fluid. And so phase 1 priority group may actually get larger just because of what's happening and based on vaccine availability. So I'm going to now speak very quickly, because I'm coming to the end of my presentation, about different policies that can support vaccine access. And this is really important because we recognize that, during the pandemic, we've been asking everyone to stay home. Please stay home if you're sick. Don't go to work if you don't have to. If you can work from home, please do so. The hard part, of course, is that we need to provide adequate government supports when to enable people to stay home. So right now we have asked the province on several occasions, more than 3 right now, to implement a paid sick leave program. So therefore, if you are sick, you shouldn't have to go to work. And you also shouldn't have to choose between paying your rent or putting food on the table or potentially leaving your house when you're sick. And so this is clearly a policy gap that still exists, one that I think lots of cities are asking the province of Ontario for. And unfortunately, we have not received a positive result as of yet, which is, in my opinion, very shameful because it literally has been a year of different cities asking for this. Other additional supports that are needed in order for people to overcome vaccine hesitancy, but also to enable vaccine support, is that we need to provide extra resources and funding to support workplaces so that when they do hire temporary workers, they can do so and adequately train them to use protective equipment and to ensure infection prevention and control measures. So it just meant that during the last 12 months, companies were left on their own, workplaces were left on their own. And if we could, and we recognize that if workplaces are left on their own, people were left on their own, workers were left on their own. We needed to have something that was much more regimented, and we needed to have government support for those workplaces and workers. So the City of Toronto does have a COVID-19 immunization task force. Every order of government has them, and they've been working really hard to build additional awareness. Another critical support, which I think I'm going to end on this point, which I really believe that we needed and we don't have in place, is a eviction moratorium for residential tenants. We are facing a major housing crisis, not just in the City of Toronto, but also in Ontario and right across the country. But when it comes to the provincial responsibilities, if we had a strong provincial eviction moratorium on residential tenants, then we know that people can stay in place and stay healthy. Right now, lots of people have seen their wages decline because of lack of available hours at work, or to perhaps a loss of income, and they need to be supported through this very difficult time. And this is one of the 2, I would say, key areas when it comes to the social inequities about the pandemic that have really, we've seen some failure. So one is the lack of paid sick day leave, and the other one is a true eviction moratorium on residential tenants. And I'm going to end it here just because I think it's been a long evening and you've been a great audience. But I'll be happy to answer any questions that you may have, and I'm happy to continue to learn with the panel. Thank you so much.
Thank you, Christian, and thanks for all your our speakers. Since we did start a few minutes late, I would request our speakers maybe to stay another 5-10 minutes later than the scheduled end time. But I've been collecting questions, and I know some of the very straightforward questions you've been answered in the Q&A, but maybe I can start with a bunch of access-related questions, and then maybe Domenico and Christian can take a stab at them. So what language assistance is available for seniors and people who don't speak English? I know you talk about the ambassadors in the community, but in a more like governmental or public service level, what would be available? And if people who doesn't have OHIP, I know that they can still access the vaccine, but I think from what Domenico was saying, that they need to call the provincial number instead of registering online, right? So I don't know how that would be easily accessible, and what kind of response would people be expecting when they call? Like what kind of questions would be asked of them if they don't have health card? And then I guess the other question is, so those 2 are direct access question. I have another set of related to access, but different question. Maybe you can answer those ones first, about language support and about when people without OHIP call, what kind of questions they might be asked before they would be accepted for vaccination?
In terms of language support, I mean, the City of Toronto has access to a language interpretation line if that is ever necessary. In addition, we have information about the vaccine translated into a number of different languages, actually about almost 30 languages, which include simplified and traditional Chinese. And actually the consent forms, so getting informed consent from each of the clients, the consent forms are also available in multiple languages. In terms of people without OHIP calling the provincial number, I'm actually not totally sure what kind of questions they get asked. I can certainly follow up with that, but like they would be asked to bring some sort of identification if they have it. But there's no restrictions based on health card. It is free of charge for anybody who wants a vaccine, including people who are undocumented and uninsured.
Thank you. Christian, you have anything to add?
Thank you, Alan. I would say that, if you're not able to get through and get the answers that you're looking for, you can always contact your local counselor. One of the things that the City of Toronto has set up is a very special counselor hotline that sort of gets us answers very quickly on behalf of residents and constituents. So I would encourage you to also contact your counselor because we can get that information for you very quickly. Toronto Public Health is very, very busy as all the health units. But I do think that, there are times when you have that relationship, then please do use it.
Another access question is like, do people have to get the vaccine in the area of their residence, or can they get it like if I live in Toronto, but my parents live in PO and I'm providing a lot of care for them and it's easier to get access there, would I be accepted for vaccination there?
Okay, so I don't have a simple answer to that. What the city has said is that we encourage people to get vaccinated in the area where they live, with the exception of healthcare workers who can get vaccinated in the area where they work. Now, the city run sites, they will accept people who don't live in the specific catchment areas. With the hospital sites, it's different. It really depends on which hospital. So I was on like the Humber River regional hospital site, and they said, it's for health right now. It's for healthcare workers who work in their catchment area and people who live in their catchment area. So they're very specific about their eligibility. Whereas Sunnybrook Hospital says anyone can pre-register, but we will be prioritizing people who live in the area or healthcare workers who work in the area. What I would recommend is if you are going to get vaccinated where you don't live, and if you're going to get vaccinated in a non-city run site, I would call the number in order to make sure that, if you're planning to go to Humber River or Sunnybrook or wherever else, whichever other hospital, make sure that you meet their specific residency criteria. But the City of Toronto runs sites. While we encourage you to vaccinate where you live, we won't turn you away if you don't live in that area.
Oh, sorry, I was muted. Thank you. One more question. So I think there is a question and answer question about who's running the mobile clinic. And I know that it was answered that both hospital and community clinics been running it. But I guess my question follow up with that is how can we initiate or mobilize to organize one for communities that we think are vulnerable, at risk, but not already connected to the system?
So with that, I'm happy to take any requests and forward them to the right people. So, you know, like Ontario Health Teams, for example, they are doing a lot of vaccine coordination. And I think, you know, connecting with those groups is important as they plan their mobile. But in terms of city-run mobile sites, you know, that's certainly something I can take back for consideration if there are
Great.
priorities.
Okay, thank you so much. So I'm just rushing against time, so thank you. There is quite a few other questions, and I think some are answered in the chat, but I think it's worth asking again. So some participants asking whether people with penicillin allergy can get a vaccine, and also people who immunos who have like reaction to IV dye when they took a MRI test or something before. So other kind of allergy history, would that be a concerning thing, and what precautions should people take? I know Daryl's tried to answer that online already. Maybe you can quickly summarize that for the live audience too.
Sure. The short answer is that that would not be a reason not to get the COVID-19 vaccines. So the only medical reason that we would ever tell someone that they should not get the vaccine is if they know they have a severe allergy to one of the specific ingredients that's in the vaccines. Even if you had an allergy to something else in the past, even if you have a severe allergy to something else, it does not necessarily mean that you're going to have that reaction to the COVID vaccine. And the priority is to get as many people vaccinated as quickly as possible, as has already been said by others. Sometimes people wonder, how am I supposed to know if I have an allergy to one of those weird chemicals or those weird listed ingredients in the vaccine? It's a good question. The answer is really that when the only reason not to get the vaccine is if you do know that you have had such a reaction. And people who have had a severe allergic reaction in the past have typically been counseled by the doctors who looked after them about what the specific thing was that they figured out caused it. Everybody is asked to stay in the vaccine center for about 15 minutes after they get the vaccine to make sure that they're doing okay. And that's the way that we will pick up the very, very, very rare people who will unexpectedly have a severe reaction. But that's, again, expected to be extremely, extremely rare. So having an allergy to something else is not a reason to not get vaccinated. We would definitely recommend it.
Mm-hmm. So the slightly related question is like, I know earlier there was like precaution for people who are pregnant, people who are immunosuppressed. So, and then there is a question from someone who said like, if I have cancer, but I'm waiting to start treatment, but haven't yet start treatment, how do I know whether, you know, I need to worry about it? Maybe Stephanie can take a step at this one first.
Sure. I mean, I think that obviously each individual patient should have a discussion with their specialist, their oncologist, but in general, we would still recommend that you get the vaccine. Sometimes there may be a difference in terms of the timing of when you get the vaccine, in terms of when you get their chemotherapy or surgery, et cetera. But in general, yes, you should still get the vaccine.
Mm-hmm. And sometimes it has to do more with how well the vaccine works rather than how risky it would be, right?
Exactly. Yeah. It's not more the cancer that's the contraindication. It's more that some medications may blunt the immune response. And so you may not necessarily want to have the vaccine at the same time as that medication.
Great. Thank you. I guess since this is a Chinese Canadian forum, maybe I could ask a Chinese specific question. Somebody is asking, like, if I'm planning to return to China or Asia within the next few months, would it be better for me to wait until I get there and get the Chinese version of the vaccine, which is not available here? Would the Chinese vaccine works better for Chinese people because they were tested more on Chinese people? Anybody want to venture to answer that?
I'm happy to try to weigh in on that. Alan, I think the short answer is no, we wouldn't recommend doing that. And the reasons that I think I would say that is a number of things. Number one, we really want to emphasize the first point, which is that it is so important that we get as many people vaccinated as soon as possible. There's really we would really just encourage people to get vaccinated as soon as they possibly can if they are offered a vaccine. Another reason is that we actually don't know that much about the Chinese vaccines. There actually isn't any published peer-reviewed information about them. So they have been approved in some countries, but most of us don't have any idea on what scientific basis that was done. So I, as an infectious diseases physician, I don't know. I wouldn't recommend it to people because I don't know enough about that product, and that information is not available. And then finally, with respect to the issue about, a Chinese vaccine maybe working better on people of Chinese ethnicity, again, there's no reason to believe that the vaccines would work differently in different people. We know that with all of the vaccines trials that have been published so far, it does not look like there are differences in how well they work in people of different ethnic backgrounds. And again, all of them work extremely well at preventing severe disease, and that's what we're trying to achieve. So no, we would not recommend that people travel to another country to get a vaccine. Just get the first one that's offered to you here as soon as you can.
Okay, so another medical question is, if I've been sick before with COVID, would getting the vaccine kind of trigger another bout of the illness? Maybe Stephanie can take this one.
Yeah, sure. So you can't get COVID from the vaccines. So bottom line is no, you can't get another infection from the vaccine. There is the hypothetical chance that perhaps some of the side effects may be a bit stronger in patients who've had COVID before, just because of the immunity that you've had before. But in general, I don't think it makes a big difference.
Okay, I think we've addressed most of the questions. There's are there diabetic participants in the vaccine trials, as far as you know? There's another question in the audience. Would Daryl or Stephanie wants to?
I'm so sorry. I was typing an answer to another question in the Q&A,
okay.
so I missed the question. Maybe Stephanie.
So the question is, are there diabetic participants in the vaccine trials?
Yes, tons.
Yeah. So the other things you are, so some people are choosing to wait for the other vaccines than get the AstraZeneca vaccine. Why do these beliefs exist, and what can we tell them instead? I think that's a question worth telling the whole audience that you're typing in the answers.
Sure. Okay, so I'll recap what I typed there. I think the main reasons that people might feel that way, number one, is the numbers in terms of how well the efficacy of these vaccines that we've published in the newspapers, etc. It looks like the numbers they're not as impressive for the AstraZeneca vaccine. It's around 60–70% compared to 95% for the Pfizer and the Moderna vaccine. So some people think, oh, it's not as good of a vaccine. Another reason is that there are these news reports coming out of Europe right now that we talked about, where there's some question marks about, some people may be getting blood clots, and people might be worried about that. However, my response to that would be, no, it would still definitely recommend getting the AstraZeneca vaccine anyway, because unfortunately there simply is not, I think Dominica was speaking about this, there simply is not enough vaccine, unfortunately, right now to give us the luxury of choice. The priority is to get as many people protected as quickly as possible. And the AstraZeneca vaccine still is associated with excellent efficacy overall, as well as excellent efficacy at preventing severe disease. And part of the reason that the numbers look different from the trials is actually probably related to complicated issues that we don't maybe have time to get into in detail. And the differences might actually not be as big as they seem by just looking at those numbers. And finally, that issue with what's going on in Europe is still under investigation. I think many people, including the regulatory authorities here in Canada, believe that there is not enough concern to say that we should hold off on getting that vaccine. It looks like a safe vaccine, and those events with regard to blood clots seem like they are unrelated.
Okay, So thank you very much for all your input. I would now invite our participants to complete our exit poll, whether you get information that you think is helpful, whether it affects your decision-making about vaccine, and whether it affects your preparedness on the vaccine. And then we would also be putting as many of the questions and responses to our website afterward. I know not everybody have a chance to have their questions maybe answered in full. So we will continue to do that. But at this time, I would really like to thank our panel of speakers, and I would invite them to maybe make one final comment to our audience before we part. So maybe we start with Counselor Christian.
Thank you very much, Alan, and thank you to the amazing panelists. Certainly, it was wonderful to share this evening with you and all the participants. I would just say to anyone who's still thinking about the vaccine and the hesitancy, we've got a ways to go. But I think that if you get that call or if you are able to get that appointment, take it. Do not hesitate. I can pretty much say that it's the only way for us to get ahead of the pandemic. And your health is connected to mine. So we're definitely in this one together. So thank you very much, everyone.
Thank you. Daryl?
Yeah, maybe I'll cheat and say two quick things, if I may. One is just to say, I know that people have a lot of questions about the vaccines, and I think that's healthy that people have questions. And it's great to have a forum like this so that people can ask about their unique circumstances. In general, a lot of the questions, as we've been hearing today and discussing, are around, is it okay for me because of my specific circumstance? And, truly what we can say is that it really does seem like there are almost no reasons not to get the vaccine. If you have this medical condition, that medical condition, if you're taking this medication, you have had this happen in the past, the only reason medically that we would say in general that someone should not get the vaccine is if they have a known severe allergy to one of the ingredients. Everybody else, they're going to benefit. These are safe vaccines. They work extremely well. The second thing I'll say is that I know people continue to have concerns around the 16-week delay with the vaccines out there. And I think the important thing for us to know, we spoke about it a little bit earlier, I won't reiterate those points, but one really important way to think about it, I think, is that we're all in this pandemic, unfortunately, and it's a terrible situation. None of us want to be in this situation, but it is the situation that we're in. And part of that reality is that there is not enough vaccine to go around. That's just the way it is, and that's not likely to change anytime soon. But the virus is not going to wait for us. The virus continues to infect people and kill people every day, unfortunately. So the idea of delaying the dose is based on this principle that we want to protect each other, all of us together. And if you have 2 doses of vaccine, but you only have 2 people in front of you, let's imagine yourself thinking about your 2 parents. If you have only 2 vaccine doses, are you going to pick one of your parents and fully protect that person and leave your other parent vulnerable? Or are you going to say, you know what, both of my parents are important, and I'm going to give each of them their first dose and hope that we get as much protection as a family as we can? That's the approach that we're taking at a global level with the decision to delay doses. And it's, I think, really good public policy. So thanks so much for this opportunity to share this information and discuss with everybody today.
Thank you, Daryl. Domenico?
I want to first commend ProTech for this really important initiative, and also commend the mobilization of the Chinese community in developing and participating in this project and this webinar. I think Toronto Public Health really depends on the work of dedicated community members and community residents themselves to participate in our education and immunization efforts. So I just wanted to say congratulations and keep up the great work. And I'll be getting vaccinated as soon as I can, and will be getting the vaccine that's offered to me.
Thank you. And last but not the least, obviously, Stephanie.
Yeah, so I just want to thank all the panelists and for everyone for attending. I echo everything that's already been said. I think bottom line is, as somebody who's worked for a year now on the front lines of the pandemic, and I've just seen way too many tragic deaths, too many sad cases, that if you have the opportunity to get the vaccine, please, please, please do get it. If not for yourself, then for your loved ones, your family, your friends. Because when you get the vaccine, you're protecting yourself, but you're also protecting your community. And hopefully, you know, we can get out of this sooner rather than later.
So with that, I thank everyone for joining us, and I wished everybody a safe and healthy summer ahead of us. Thank you for joining us. Good night.